racing that we'll be talking about heartbreaks and relationships. But then you would find out at the end of our conversation. And so I will not be doing the conversation alone. I'll have with me the resourced, the well-resourced Dr. Oche. He's a senior lecturer, Department of Surgery, School of Medicine and Dentistry, College of Health Sciences, Kwame Nkrumah University of Science and Technology. He's also the foundation and current head of Cardiothoracic and Vascular Surgery Unit at the Department of Surgery, KSMD. And he is the foundation head and consultant, cardiovascular and thorax surgeon, Konfanochi Teaching Hospital. So you see that all the qualities he brings to bear would make the conversation very, very interesting. Hello, Doc. Good evening once again.
Good evening, Clinton.
It's very good to see you. I know that our listeners, our viewers, our minds are already racing whether we are going to talk about heartbreaks and relationships. What is your first thoughts on the theme, the heart of man and total well-being?
Thank you very much, Clinton, and good afternoon to, and good evening to everybody, and whoever you are, wherever you are, my greetings to you. I must say it's a very interesting theme or topic, the heart of man. One important observation is the fact that the heart as an organ or part of the body is really the most important organ in the body. The eye is not, the brain is not, the intestines, the kidneys, they are not. The most important organ in the body is the heart, and therefore the heart is the controller of everything in the body. And we all know, even from religion, that the heart is the spiritual state of the body. So the heart is really an emotional organ, an intelligent organ, and a very passionate organ, and it controls all the affairs of men.
I think that brings me to my first question. Why is the heart so special among all the other organs?
Interesting. So first of all, even in embryology, when I say embryology, before just 1 month of pregnancy, just within 28 days of pregnancy, the fetus, the newborn or the little one in the womb of a woman or a mother, the heart starts beating just within 1 month. It's the first organ to be developed to form in the body or in the uterus or in the womb of a woman. It's the first organ to form and the first organ to mature. There are so many parts of the body which go on to mature after you are born, but the heart is already mature when you are born, and it makes it very special. What is also very special about it is that, surprisingly, it's only one organ in the body, and that organ is the organ that supplies every part of the body their needs in terms of blood supply, nutrients and things, and oxygen. So the heart is the structure or the organ that supplies every need of every part of the body. And therefore, if the heart stops working, everybody in the body will die. You can have any part of the body dying. If the heart is working, the body is alive. People are born without eyes, i.e. their eyes are dead. People are born without limbs, without legs, without hands or upper limb, but they are walking around. You know the famous Pastor Dick, who has no upper limb or lower limb, no leg or no hands, but it's alive. Why? Because the heart is working. The brain can die. You have so-called brain death or coma. If the heart is beating, you are alive. But if the heart stops beating, what we call cardiac arrest, everybody automatically dies. Makes the heart very important. That's why even those who are Christians know that the most important word in the Bible, or the most mentioned word in the Bible, is the word heart. For the heart is mentioned more than 1,000 times in the Bible, making the heart very, very important. It tells you how important the heart is, even spiritual, not to mention physically, where it controls all the affairs of men. And therefore, Proverbs even will say, Proverbs 23 will say that, guard your heart with all diligence, for out of it arises all the issues of heart, of life. So the heart is very important. They are very important. Everybody plays, and we all know they have this syndrome about the broken heart syndrome and the rest, making the heart. I don't think they say broken bone syndrome. So the heart is very important. Yes.
So we know how special the heart is, and we have already mentioned the heart of man. Someone would also ask, if we are mentioning man, then what do we talk about woman? Are there special or gender differences in terms of structure and function of the heart?
This is very important to me, and I've been passionate about it, and I would like every man. In fact, the theme but the topic is the heart of man. That man there is generic.
Oh.
Actually meant both man and woman. But surprisingly, there's really differences, genetic differences between the heart of man and the heart of woman. And I wish every person, whether you're a woman or a man, should appreciate this once and for all in your life and to save your life. Number one, the size of the heart at birth, compare a boy and a girl or a female. At birth, the girl or a female has a bigger size of heart than a man. At birth, the size of a girl heart is about 20 grams, whereas the female, the man or the boy is about 15 grams. So there's about 5% difference. I.e., the heart at birth for a girl is bigger than a boy. But surprisingly, in adulthood, there's a big difference in terms of just the size of the heart of a man compared to a woman. The average size of a man, or in simple language, a man has a bigger size of heart than a woman. Or better language, I'll say that a man an adult man, has a bigger size of heart size than a woman. That is a very important information for both science and for social life, for our life. Because the difference between the size of a man and a woman is about 50 to 100 grams, i.e., every man has about an extra mass of heart, extra size compared to a woman. And that extra, the fact that the man, your heart is big, was not given by God for nothing. There's a very divine reason. And it's a good science reason why a man was given a bigger size of the heart. Why? The assumption God assumed, my interpretation, is that a woman in her life is programmed, in part we say it's apoptotic, to harass a man. So a woman's life in general is to harass a man. And it started with us today. It's not Adam and Eve. It's not like Adam. So because of that, God, in his wisdom, gave a man a bigger size so they can contain the stress. So I tell people that if you are a partner, whether you are a daughter or as a wife, is harassing you, that woman is doing her natural job. And it's important for you as a man to contain that. Why? Because you have an extra mass, and that can be done for nothing. What is very interesting, there's something called the way the heart beats. Surprisingly, because the woman's heart is smaller, God, to compensate that, made sure that the female heart will beat faster than a man. Therefore, we say that a woman's heart beat faster than a man. So to compensate for the small size, God gave the rate of heartbeat for a woman bigger than or faster than a man. So compensated for that. So when it comes to the size, yes, a man has a bigger size. But when it comes to the way the heart beats, the rate, how many times it beats in a minute or an hour, God gave the woman or the female a bigger or faster heartbeat. There's a reason for that too. In fact, the average heartbeat of a man is about 70 beats per minute. The average heartbeat of a woman is about 78. For some, 78 to 82. Meaning that a woman's heartbeat an extra 8 to 10 compared to a man. That is why there's a colloquium in this environment that says that if Obaka Bakwa, if you put it in language, Obaka Bakwa, or something, or if a man speaks once, a woman can speak 3 or 4 times. And I tell people, if a man speaks once and the woman speaks only twice, he's being kind and gracious to a man, because the woman is entitled to speak 8 or 10 extra. And it's a very important, that's what they say, that women talk too much. It is their nature. It's what God gave them. If the heart beats extra. That is why they say they are multi-talented, or multi-task. You can be cooking, gossiping, and breastfeeding at the same time. Yeah, because he has extra heartbeat. It has to be used, or they have to be used. And that's what the situation. So every man should appreciate the fact that if your wife or your daughter is harassing you, she do her job. Why? God gave you the man a big heart, and you should appreciate that. And 2, God gave the fact that the woman's heart should beat faster, and therefore the woman should speak, more. And therefore, they say in marriage that one of the most important factor for sustainable marriage is communication, or is the heartbeat. If you, a man, knows that if I speak 1 I should wait and be patient for my wife to speak 8 or 10 extra. Then you have time. You know what? Tell your wife you talk too much. You don't do that because that is how she's made of. There's an extra heartbeat. The brain is tuned that way to speak loud. That made the heart very special when it comes to all this characterization. If we put even that one aside, what is interesting that, and every man should know this, before menopause, you know, we all know that a woman has a particular chemical or hormone which is called an estrogen. Surprisingly, before menopause, you know, if the woman goes to menopause, she loses the estrogen, that hormone, that chemical. But before 50 years or before menopause, she has the estrogen. It's been found that that chemical or that hormone estrogen is cardioprotective, i.e., a man before 50 years is more likely to have heart disease compared to a woman before 50 years. The incidence reverses after menopause when the woman loses the so-called the chemical, the hormone that protects his heart from disease, the estrogen. If everyone knows this, that you know before 50 years, you as a man, you have a higher risk of having or developing heart diseases. You be careful how to manage your life before 50 years. You know that there are so many young people, 30, 40, 50, 30, 40 years, they are all hypertensive. And hypertension is a heart disease, or better still, is a cardiovascular disease. But we all know that 30, 40 years, that's why every young man, you are working well, you are married, your career is booming, you are doing so well, you are stressing yourself. If you are a smart person, you should know that that's a period, you should be careful how to chase or be monitoring your heart condition, because you have a higher risk as compared to your wife to have hypertension. That's also so many young people have hypertension because the woman is protected from the estrogen. And what is even very important is that, you see, when you are stressed up, God made it said that anytime any human being is stressed up, like if you run right now, your heart starts beating fast. I.e., if you are stressed up, one of the response the body will do or give you is that your heart rate increases. If your heart rate increases, the way your heart beats, how many times the beat increases when you are stressed up, like when you run and your heart beating fast, what happens is that it can give two responses. The reason for your heart rate to arise when you stress yourself, the fact that the body needs more blood, and therefore the heart increases so that more blood will be pumped to the all parts of the body needing that, like doing exercise, need more blood to supply to the part of the muscles who doing the exercises, and therefore the heart increases. If the heart increases, the heart pumps more blood, technically speaking. Or if your heart increases too, your blood pressure can rise. What happens is surprising is that in females or in women before the 50 years, when the woman is stressed up and the heart rate increases, the body of the woman will respond by pumping out more blood to supply to all parts of the body. As opposed to a man, when you are stressed up before 50 years, instead of more blood being pumped up, you have more chance of rather your BP rising. So two things, the fact that as a man, if you are stressed up, your BP will rise. In a woman, when she's stressed up, the more blood is pumped up, and above all, she has a chemical or a hormone that protects her from heart diseases. Therefore, every man, if you're a smart person, should be careful of your life from 30, 40, 50 years going. That's the time you have a highest risk of having cardiovascular disease.
It's actually very interesting how the small heart of a woman is able to do much, whilst the big heart of a man is only made to accommodate tension and other stuff. But since you mentioned stress, let's talk about heart health. What is the relationship between our heart's health and stress?
Very important, to the extent that in general, before even I get to that, 3 very important issues when you really want to protect your heart from diseases. Number 1 is diet. Number 2 is how to manage your stress level, and then how to prevent your diet. Number 1, how to be careful about it, and then how to manage your stress. Very important, because you know what? We did a study in Kofanochi. We look at patients with kidney diseases, and we review in Kumasi here 13 years review, finding out for 13 years what is the shape or the pattern or the nature of people who have kidney diseases. What we realized that, number one, starting from those who had it, those says, I may start from age, we realized that if you compare male and female in Kumasi here, the average age for a person in Kumasi to have kidney disease was around 45 years. It was very close to more. In fact, the women were 44.6 years, the men were 45 years. So it means that in Kumasi here, the average age for you to get kidney disease is around 45 years for both male and female. Then we look at the occupation of people who had disease in the environment and realize that traders form about 50% of people. We look at traders, look at pastors, we look at business, civil servants, and other business people. And the commonest, or the people, the group of people who were really exposed to having kidney disease, and the kidney disease in the environment, number one cause is hypertension. But those who are the group were those who were traders with low basic education or basic education. Traders. Why traders? More than 50% were traders. And if you look at Kumasi here, most of them are buy and sell. Yeah, you know. So maybe they'll go to Dubai, they'll go to travel to China, they'll go to Togo, they'll go anywhere, bring some ports. Sometimes have issues at immigration, issues at the port, and they buy on the market. Some will come for their goods. They may not pay them. They go to a lot of stress. So there's a direct relationship between stress and the development of heart diseases. Do you know what? What we found out that the lowest group of people who had the lowest incidence of getting kidney disease in the environment were pastors. Less than 1%. And that was surprising. Why pastors were the group of people who had the lowest rate or risk of dropping kidney disease here. Our assumption is that because the pastor at church has to come and encourage you, motivate you. So you may have issues, you attend church. It's his duty to encourage you and to how do I say it? Just to suit you. Is that right? Yeah. So our pastors basically are kind of a pseudo-psychologist in our environment here in Ghana. They play that role of encouraging people. So if you are the one who will encourager, of course, you as a person, you have to be stable emotionally before you can do that. So we realize that the pastor actually, they are self-conceit. They are okay in their life. They try not to be too ambitious, not so much about issues of life. So their stress levels were low. Though the work is very stressful, but in terms of emotional instability and other stress events were very low, and therefore their incidents were very low. So from this stage, realize that if pastors had the lowest rate of having, say, heart diseases in the environment, and the rate in among traders was very high, it means that there's a direct relationship between stress and having diseases. And I did say that anytime you are stressed up, your heart rate increases. The heart response, if you are stressed up. That's the initial physiological response. But as it goes on and it perseveres, then it turns to become a disease. In fact, what is really interesting is that when we find out even grouping divorced people, marital status, in relation to marital status and the kidney disease, we realize that divorced people and widowers had the lowest rate. Married people, 65%. For 64.5. To say that amongst divorced, widowers, single, and married, if you are a married person, you are high risk of having heart disease. Why? It was 64.5%. So, marrying you go to marry, but why? Because there are issues of marriage in the environment here. A lot of stress, emotional things. That's what I'm saying, that if you could manage ourselves carefully as partners, especially the man, knowing that a woman is to harass him. That's why I guarantee that women should go around harassing men anyway. But point is, if a man knows that if a woman is harassing you, she's doing her job. Don't take it to heart. Don't worry yourself. Because you worry and take it to heart, you have hypertension. If you have hypertension, your life has changed. All other diseases follow hypertension will follow you. So it's clear, established that stress plays a very important role in the health of the heart. And therefore, stress is a very important role in causing heart diseases in the environment and globally.
I think we are having a very interesting conversation. For those watching us and for those listening to us, you have the chance to send in the questions you have for Doc. And I mean, I think at the back door, I would want to find out from Doc if he made any researches about journalists, because I feel like we also need our part in this conversation. But since we have been mentioning diseases throughout our conversation, what are the prevailing diseases? What are the common diseases, heart diseases that we should know of?
Very important, and to the extent to say that there's a recent study done by one of our professors in the medical school, Professor Anson and his group. They study the rate of hypertension. Hypertension is a very famous heart disease globally. In fact, the estimation is that just by next year, 2025, the whole world will have a total of 1.5 billion people with hypertension. Wow. Hypertension is the commonest heart disease in the world and the commonest killer in the whole world, especially in Ghana here. They did a study in Ashanti region to find out the rate of how many people in Ashanti region or Kumasi, if I want to put it that way, have hypertension. And they came to the conclusion that the rate of the incidence or the prevalence of hypertension in Ashanti region is about 37.4%. If you approximate it, 37.4 is like 40%. That means that in Ashanti region, if you take 10 people, 4 people are hypertensive. That tells you how, yeah, it's very high. 2 in 5. In general, if you take 5 people, 2 hypertensive. What is surprising is that 68% of people who are known to have hypertension have not been their BPs are not controlled on their medication. So they take medicine, but it's not, the BP is not controlled. And as if you are not hypertensive and you are taking medicine and the medicine is not controlling your BP, then it's doing nothing for you. It means what we call natural history or the complications of the hypertension will not change as far as you having it. So hypertension is the number 1 heart disease in our environment. Even to say that yes, we have heart disease in children, like we, for example. Yes, I mean, we the famous hole in hearts, So children are born with some structural defects of the heart, which we deal with, because they're congenital heart diseases there. But if you come to adulthood, I mean, that in adults, the commonest heart disease we have in the environment is hypertension. Now, the point is, if you have hypertension, it has numerous complications, or it has cousins that it can bring to you, cousins. So as soon as he comes, he will go and call his friends also to come. One of his friends diabetes. And if you heard that so many people are both diabetic and hypertensive. Diabetes is a cousin of hypertension. So if hypertension, will go and call his brother. Aside that, hypertension itself can lead to a lot of complication in some parts of the body. For example, you can lose your eye from hypertension, cause some hypertension retinopathy. You can have ballooning of the pipes and tubes, that blood flows to your body because of aortic aneurysm. You can have heart attack. Heart attack, myocardial infarction is a complication of hypertension. You can have stroke from hypertension. In fact, the commonest cause of stroke in the environment here is hypertension. So if you have hypertension, there's a lot of siblings: stroke, heart attack, aortic aneurysm, aortic dissection, kidney failure. No, he'll go and call all of them, including his cousin diabetes. That's the issue about hypertension. That's why it's very important we all pay attention to it, and we should not live in denial to say that, for example, in reality, normally, as you age, your risk of developing hypertension increases. In fact, by middle age, by 30, 40, 35 to 45, your risk of developing hypertension is 135%. The American Heart Association said about 36%. So your chance of developing hypertension actually increases with age. So the point is that if you are 50 years, not to say that the thing is the way there is risk. So it's possible you have a 50-year-old who is free from hypertension, you have a 30-year-old with hypertension. The mere fact that as you age, your risk of hypertension increases means that if you have hypertension as you age, no twist about it. Thankfully, there's medication to control it. So don't go anywhere for someone to pray for you, or you go to some malamani or fetish priest or a father or a pastor say I pray for you. Go, no, it's a chronic disease. It's a chronic disorder. Chronic means that you should take medicine for the rest of your life, and just may have a fine doctor somewhere who monitor you monthly or something for you. So point is that hypertension is the commonest heart disease, and they have so many cousins, which are basically complications of the hypertension, which if you get, then you can get that as well. And the management have become very complicated for you.
Doc, since you mentioned that some hypertension is a chronic disease, are there some heart diseases that can be corrected through surgery?
Absolutely, absolutely, absolutely. For example, we usually say that what causes hypertension, we don't know. You take 100%, or you take like 10 people who have hypertension, 8 to 9 of them, we don't know the cause of the hypertension. What we know are the risk factors for the hypertension, stressful life, other things which are there. But there are few causes of hypertension which are known, which you call the secondary causes of hypertension, which are known. And some of them can be treated surgically by operation. For example, there's a very famous cause of hypertension called coarctation of the aorta. Okay. It's a disease of a big tube or a big pipe where the blood is pumped through from the heart that supplies every part of the body, called the aorta. So that can be narrowed, can become smaller. It becomes smaller, it gives a high BP hypertension. That one's very easy. We can go and operate and open up that vessel which is narrowed, and that hypertension can be corrected. There are some few tumors, disease of the kidney, cause of some organs called adrenal gland. There are some few disease of some organs in the body that can present as hypertension, but that can be corrected by doing surgery to solve them. But majority of the cause of hypertension, I would say we don't know, more than 95% or 90%. And those are the ones come from the risk factors, being obese, stressful life, sedentary life, those kind of things. If you get it, that would be on medication for life. That you see as a surgeon to know that there are few surgical, we call surgical hypertension, cause of hypertension. Those ones, we can operate, do surgery to correct them, but there are few of them, and they're identifiable. But if you get them, we can do that and solve a problem for you.
Okay, I think, and I feel like no young person would want to fall prey to heart diseases at a younger age. And so your advice to the youth, we seem to be more exuberant, we seem to be more on some things. What would be your most critical advice to the youth concerning their health?
Fantastic. God being kind, the expectation is that a young person should not have any abnormality or disease of the heart. But of course, you have seen young people with hypertension. I've seen last 2 years, there was a medical student in 4th year, young lady about 22 years, very bad hypertension for her. So yes, normally, because a young person, your things are normal, your organs are normal, the heart has not been stressed up really for a lot, and therefore you don't have that. Aside that, I want to say that, as I said, that of course there can be disease of the heart you can be born with. Yeah. If that one's there, we can diagnose it in young people. But hypertension, the rest, basic things, that one you don't get them. What I realized is what really is worrying is the rate of consumption of alcohol and then smoking. Yeah, if we start smoking very early in life, because smoking and alcohol consumption can be risk factors for hypertension in future. Okay. So therefore we start very early. Yeah, start very early. And I remember when I was in Accra, I saw so many of the celebrities, the media people, your people there, journalists, plenty of them, very young, 30s and 40s, they were hypertensive. I said the fact that the work they are doing were very stressful, and they're also doing well, and they were exerting themselves. They also cracking some alcohol and do all kind of things, and therefore. So my advice for them is that, thankfully, you're a young person, enjoy your youth, your heart is good, hopefully, but please don't indulge in alcohol and smoke very early in life. If you do that, then your risk of having heart conditions increase earlier than expected in a normal person who doesn't involve very early in life.
Wow, interesting. And so we have had, and we are still having a very interesting conversation with Dr. Otchere. For you listening to us and for you watching us, you can send in the questions, and I feel like more of you would have more questions to ask, especially with the relationship of heart health and the relationship you are in, how medical advice could could help curtail some of these challenges. But then I've seen and I've realized that there are some questions coming in. Someone says, God bless you, doctor. And another is asking, can heart diseases be transferred from a parent to the offspring?
Okay, so not directly, but it's a risk to say that no matter if you come to the clinic, we'll ask you if your first generation relations, like your parents, your father, your mother, your uncles, your grannies, your grandfather, grandmother, have hypertension disease. And you have another person whose parents or family member have no heart diseases. The risk for the one with no history in the family is less as compared to the one whose family has a history. To say that if your parents have heart conditions, then you, as the next generation, has a higher risk. It's not sacrosanct to say that since my father is hypertensive, by all means, I also get hypertension. But the point is that when your father is hypertensive, your mother is hypertensive, you have a higher risk as compared to the other friend of yours whose parents are free. And therefore, it's incumbent for you to be careful with your life, to take extra caution so that you don't develop as early as possible. That's the only thing. But transferable, no.
Doc, are you in any way saying that heart diseases could be hereditary?
Few situations. And if there are going to be few situations, the few ones are the ones you are born with. For example, if your mother had congenital heart disease, he was born with a congenital heart disease, that mother get pregnant, there's a very high risk for that baby to get congenital heart disease.
Interesting.
Yeah, that's what it means. If that's congenital, that's what you are born with.
Yeah.
But aside that, that's the way you can inherit. Really, if I put that way, but it's not even so sacrosanct that as far as my mother had a heart disease and he get pregnant, I also have it. No, really. But for this particular one, the whole in heart, the congenital heart disease. If your mother had a congenital heart disease, whether when she was born it was corrected by surgery or not, if that mother get pregnant, then that fetus or that baby in the womb has a higher risk of having, kind of transferable higher risk of having congenital heart disease. But really, it is not. It's probability, and therefore can escape it. Otherwise, most heart diseases are acquired.
Wow. Doc, you in your earlier submission, you mentioned that eating habits could be a contributing factor to heart diseases. Could you share some few tips on proper eating habits?
Absolutely, especially when you start growing up. Obviously, when you start growing up, you have to cut on things. Diet control is one of the most important things to deal with. In fact, diet and stress management are the core values as you grow up to pay attention to. How to manage your stress level. That's something I like on Chami. Is it called Chami Kwame? He just enjoys himself. So I watch enjoys himself.
Yeah.
It means you know how to manage your stress level. Very important. And your diet very important when you grow up. We all know that in Africa here, we are sensitive to salt. We like the salt. And salt, increased intake of salt has been associated with developing hypertension.
Okay.
In fact, there are people who we call salt-sensitive hypertension. Like they have hypertension. You give them so many types of drugs to control it, but it's not being controlled well. So salt is very important. Obviously, your oils are very important. Oils are very important. I call something called GBC. Two are molecules. One is called the GBC. G is a glucose, C is your cholesterol, and B is your blood pressure. As you age up, this GBC, you must follow them carefully, monitor them, and manage them. Your glucose level, your sugar level, very important. Sugar level means you should be careful how much carbohydrate you take, how much of kenke, how much of fufu, how much ampese you take, very important. Your glucose level. Two, your cholesterol level, very important. As you do well, young person, you are doing well, you want to eat well, and you are somebody who were denying when you were young for good food, you think I have money, you want to just kind of eat everything you want. Remember that as you eat so much, you should be chasing your cholesterol level to make sure the cholesterol is not rising. As your cholesterol rises, then cardiovascular disease increases. And of course, your blood pressure, you check it. So coming to diet once again, oils are very important, salt are very important. Basically, these two, if you take them very carefully, you'll be fine with it.
Interesting.
Yeah.
Doc, we've had some students asking questions. We know that from your research that you made references to, you mentioned traders, married couples, and divorced couples. For students, what is in for them in terms of heart diseases? They are also the ones that are likely exposed to some stress, including academic stress. are they also, I mean, on the verge or on the chance of getting some heart diseases?
It's very important because anytime you're emotionally unstable, you put stress on the heart.
Oh.
And our assumption is that when you are in school and university, your first passion or first duty is to learn. Yes, when we were here a long time ago, 1994, there was something called the October Rush. I guess it's stopped now because you are having a private hostel. You all have every October when they come first year, all the states go in church in October. You call October Rush. And it comes to broken heart. And I know there are so many students here who enter into relationship very early, who have on campus. I've been told some of you living as couples on campus here. And that's very careful because there are so many things, so many life ahead of you. Yeah. And then if you have so-called broken heart syndrome, which is an emotional thing, I've told the heart is an emotional organ. The heart is a very emotional organ. The Bible says that a happy heart is medicine. So the heart is very emotional. But anytime you are emotional, you are putting stress on the heart. Anytime you're putting stress on the heart, you are weakening the heart. So if you enter relationship very early, if you have two people, one enter relationship very early on campus, and then got broken heart, and you stress about it, so you go to say, give you psychiatric issues, mental illness out of it, and somebody who just went through that issue was quiet and left that, the two people, your hearts are the same. There's already a stress heart already for the one. So my advice to you, those people on campus, that please be careful with your heart, manage your heart carefully. That's what the Bible says, keep your heart with all diligence, or guard your heart with all diligence, for out of it arises all issues of life, including your degree here. So please be careful. Don't enter relationship very early here, and don't exert and put stress on your heart. Relax. There's so much ahead of you in your life, and take your time and go out there. And because there are more stress for you. You're going to go out there, you go to a relationship, you're going to work, there's stress there. You're going to marry or something, you'll be stressed there. You're going to have children, with stress there. And your heart should be at least be conserved whilst on campus to withstand the stress ahead of you in life in future. So that'll be advice for them. You should be careful about their relationship here on campus.
I think, Doc, some of our viewers have taken notice of some of the critical things you mentioned, especially the fact that some heart diseases are chronic. But then we also find some spiritual herbalists who claim to be able to solve some of these, to be able to have a solution to some of these issues. What would be your comment to that?
That would be a challenge to say that the fact that what I assume they may be doing is kind of playing a role of clinical psychologists. Maybe when you go to them, maybe what they will tell you may suit you and maybe relax you. Basically that. But to treat the heart, no. By anything, no. So it's just basically playing the role of a psychologist in kind of a herbalist thing. Yeah, but there's no way there's thing to establish that you can take some herbal preparation to cure your hypertension or take herbal preparation to cure any disease of the heart. No.
So all the prayer comes may not be.
Yeah. So as I was saying, the heart is a spiritual. The heart is a spiritual man. The heart is emotional, and therefore it's sensitive to emotion, sensitive to spiritual things. So probably if you pray for any heart disease condition, the heart will hear about it and relax and make sure that it's less stressful. Yes. I must actually add that the thing we did in Kumasi, the 13-year review of kidney diseases that we did in Kumasi, what we also realized is that the rate of heart diseases in Christians, they use religion. Religion. The rate of heart diseases, especially chronic kidney disease, in most Islam, like Muslims, were less than 10%. 90% of the patients were Christians.
Are there any significance? Are there any interpretation to the data?
It tells you the nature of life. You know, if you look at the Muslims, they can marry 4 people and they are fine. I don't think it's very easy for the non-Islamic person to marry 4 people to be easy. You hear of people secular world, the big men who are married 1, 2, 3, 4, 5, how there can be issues among the people. But how many times you see issues among even the wives of a Muslim? So it tells their orientation and their perception and how they carry themselves, how they don't stress out their lives. And I've been told that even some Muslim wives can just live peacefully, so nicely, and can be take care of each. Take care of each other. and say married one person. But that's not very common among the secular people, as we put it. Obviously, we don't expect Christians to marry 2 or 3 or 4 people. So to me, I come to the conclusion that the Muslims are more relaxed, they are more comfortable life, they are content, they don't desire and so ambitious, and therefore it reflects. As far as you are not stressful to put stress, anytime you are stressful, the same stress, you are stressing the heart. And you stress the heart, you are weakening the heart, and your rate of hypertension increases. And if you get hypertension go and call all his cousins, including diabetes, heart attack, kidney disease, aortic dissection, aortic aneurysm. You go and call all his cousins and come and occupy the place for you, and then they will torment your life. So you should be careful. If you manage your stress, you manage your diet, you'll be fine.
Interesting.
Life, yes.
I think one thing I've enjoyed about this conversation is how multifaceted it has been. Traders have had their share, Muslims have had their share, Christians have had their share, students have had their share. And that's what makes it more interesting and more educative. And I'm also very sure how people listening and watching us are also appreciating what we are doing, and thanking Doctor for being and sticking around with us. Doc, can I get your final comments so we close the chapter on this conversation? Great.
And I thank all the listeners or those online watching. That I want to say that, first of all, the heart is a very important organ. That's why, even as I was saying, is the one that controls everything. If the heart dies, every part of the body will die. Any part of the body can die. If the heart is working, the person will be alive. And therefore, let's be careful, as even there's admonition from scriptures, that we should guard. The word they guard the heart. And I say guard the heart or keep the heart. He also add the word diligently. Even to keep it, he made adjective to it, or advert to it, that you should be diligent, caring, and guarding the heart. That tells you how important the heart is. And how do you do that? And I'm saying number one risk is the one phrase you do that: be careful as you age how to manage your stress. Because there's that relationship between stress and heart diseases. If you manage your stress carefully, know how to go on vacation, how to go on leave, how to rest, and remember that God created man and woman with differences in the function and the structure of their heart. And I was saying, and I'll keep on saying it again, that a woman has a smaller heart compared to a man, but the woman's heart beats faster. These two structural informations are very important for every man. If a man appreciates that a woman's heart is small, he will know how to handle his wife or his partner carefully. And if your partner is worrying you, though I'm not saying it's a guarantee around that you should go worry all the men, but if a woman is worrying you as a man, harassing you, she is doing her divine job. And God gave you an extra heart to it. Don't stress up, don't take it to heart and hit and hit. I remember I had a story about the most Nigerian gospel who was hit by the husband and then even killed her. That's very callous. You can't do that. So never hit a woman. He's doing her job if he's harassing you. Number two, the heart beats faster for a woman, and therefore, please be patient with a woman. She can be multitask, and she can speak a lot or talk a lot. Be patient with her, and listen to her, and you'll be fine. And finally, please be careful with your diet, even as you age. For young people who are growing up, you need your food. You need all kinds of food to eat and be well, to grow very well. But for elderly people beyond 30, 40 years, and I was saying that as you age, there's a higher risk to get hypertension. So be careful with your diet. Be careful with your cholesterol. Be careful with your cholesterol mainly. Be careful with it. And I said there are 3 things you have to monitor as you age. You call it GBC. Be careful with your glucose. Monitor your glucose carefully. Monthly, 6 monthly, every 3 months. Monitor your BP carefully as you age. So that as soon as the small signal that your BP is rising, you can deal with it before it becomes very complicated for you. And then check your cholesterol. So manage your stress, check your cholesterol, check your glucose, and then check your blood pressure. These 3 things, your glucose, your cholesterol, your blood pressure, if you can be careful about them and monitor them, and in addition to monitoring your stress, you will live long to see your generation, your children's children, and enjoy them.
Right. I believe that this conversation about heart has really gotten into your heart. Thank you very much, Doc, for honoring us and honoring our invitation, and also giving us the most, or one of the most educative segments on this show. We're very grateful. And also to you who have stuck with us throughout the show. We are very grateful that you stick to us. And we liked the comments that you brought. And we appreciate you for also sticking and staying around. And so another thanks also goes to the KNUST e-learning center for preparing a program like the e-learning podcast series, which enacted this conversation we are having today. Heart of a man, or matters of the heart, are very important, and I believe that we have had an elaborative conversation, to bring to bear the precautions, how to take care of the heart and what to do with the heart and how important the heart is to humans. My name is Clinton. Do not forget that this segment we are having was brought to you by the KNUST e-learning center under the e-learning podcast series. We hope to see you same time in our next segment. Thank you and welcome.
Thank you.